Hello, and welcome to the MIMOSA Matters podcast series. In this series, we will bring you interesting perspectives on the clinical, research, and technological perspectives from near-infrared spectroscopy imaging, or NIRS, and introduce you to MIMOSA Diagnostics. I'm your host, Douglas Queen. Today, we are bringing you a MIMOSA Matters Poster Chat, where you can learn from our collaborators about their important research. Thank you for tuning in and joining us on today's podcast. We will be hearing from Christy Handley, Regional Director at RestorixHealth in Framingham in the US. Christy is a registered nurse with 15 years executive leadership experience. She has held varied positions in ambulatory surgery, physicians' offices, and hospital. This includes inpatient, OR, ER, and psychiatric leadership positions. Welcome, Christy. Let me start our conversation by asking you a few questions about your poster entitled Optimizing Hard-to-Heal Wound Healing, Integrating Near-Infrared Spectroscopy and Thermographic Imaging into the 7-Step Wound Management, such that our listeners can get some insight into your experience with NIRS imaging.
Okay.
Tell our listeners a little bit about your clinical practice and experience.
So I've been with wound centers for almost 8 years now. And so I deal with, that's really all I've dealt with for 8 solid years is just wounds and wound healing. So I have a lot of knowledge about our difficult healing wounds because the wounds we get are not the easy ones to heal.
Give our listeners some background into the study featured in your recent poster at the SAWC Fall Conference.
So this poster was really my brainchild. I had seen someone in our company recently do a 7 steps of healing poster. And I thought, well, that just kind of led me to why don't we see where the NIRS technology takes us in the 7 steps of wound healing? And so we realized there's really no place it doesn't have some place, simple fact, is there enough tissue oxygenation? That's where the whole thing starts, right? That's what everyone's looking at with NIRS technology. But it's also showing temperature of the wound. Is there some infection in that wound? What's the size of the wound? Is the size of the wound changed? So there's so many places, obvious and not so obvious, where this technology will help you out. Do we need a silver dressing? Is there some infection that we're dealing with, and do we want some different kind of dressing for this wound because the temperature is different than the rest of the skin? And so, I just think it gives a piece that's not so obvious. Everyone uses it for the same thing. And now let's see where else we can use it. We've got the technology. Why aren't we using it every chance we get a chance?
And what was the outcome of the study?
Outcome of the study was exactly kind of just what I said. There is a million ways to use it. And the study just outlines such as the dressing, such as the tissue oxygenation. Are we getting enough blood flow? Is the wound too moist or too dry? Like it just, every step of the 7 steps, it gives some answer that helps you optimize that wound healing. Is there infection? Should we use a skin sub? Let's, that's how this kind of really started, was my poster on, how this technology can be used to prove that skin subs are healing. So when you get to that step in the wound healing process, are we seeing results when we use a skin sub? And so doing those serial photos to show the difference week after week after week of using skin subs to prove, one, to insurance companies that we're doing this appropriately and that it's working for our patients, that it just gives you more answers, gives you a little more. We used it on someone recently that had a healing wound. And this was actually an HBO. So, it's also before and after HBO to teach patients, to teach doctors, million uses. But we used it recently on a patient who was over her normal HBO course. So let's say she was at 65 dives, and that's more than you typically see, but she was healing. She was healing slowly. And it was difficult to see that healing without being able to see behind the skin at that point. And the MIMOSA camera helped us to show that healing and get the insurance company to approve further dives. So it's just useful in every aspect of wound healing.
Okay, what is the key message of the poster that you would share with your clinical colleagues?
That NIRS technology gives you insight further along than what we had before. It gives you just a little more insight into so many aspects of wound healing that you don't have without the technology. In other words, what is the temperature of that wound? What is the tissue oxygenation of that wound? And just recently with the tissue analytics, it also gives you what is the size, and it compares time over time. And, every time I do one of these talks with you, I talk about the serial pictures, because that's where you get your information. One picture in time just gives you information. But if you've taken a picture 6 weeks in a row and all of a sudden the temperature went from the normal temperature, it's been pretty stable, and now it's changed dramatically on week 6, there's something wrong. And that's something you wouldn't know without this technology. So using this technology and all the 7 steps of healing gives you a little more information behind the scenes than you'd have had without it. And so I think as they bring this forward as a vascular assessment tool, as a way to prove clinical results with skin subs and advanced technologies, it's just amazing. So we're really enjoying having that behind the scenes technology. We just recently had a patient with a closed wound, but below the surface of the skin, there was an open wound. So you couldn't see it with the naked eye, but with that camera, you could see the lack of tissue oxygenation below that wound. And we were able to heal her in HBO because we could prove to the insurance company there was damage underneath that skin. So I've got a million great examples. It's been a great tool.
Thanks, Christy. Thank you, Christy, for giving our listeners an in-depth insight into NIRS imaging, MIMOSA Pro, and its utility in clinical practice. Well, that's our poster chat for today. We hope you've gained some new perspectives on NIRS imaging and its utility in wound management. Be sure to visit MIMOSA Diagnostics at www.mimosadiagnostics.com and visit our social media channels. Add your comments and learnings. We want to hear from you.